Signs of autism sometimes become noticeable in school-age children. This is because a new primary or secondary school environment might be overwhelming for autistic children and teenagers. The transition to it can be difficult for children to manage on their own. And if children have been hiding their autism sign until now, it might be hard for them to keep doing this in a new and overwhelming environment. Hello parents, today I am going to discuss some of the main signs of autism in middle childhood and adolescence. Autism spectrum disorder or ASD is a name used to describe a wide range of neurodevelopmental conditions that can be observed through certain behaviors, communication techniques, and styles of social interactions. Autism is called a spectrum disorder because the outward signs of autism can range on a spectrum from mild means not very noticeable to severe means very noticeable compared with what is neurotypical, basically what many would call the social norm. The signs can also change as you age. Autism spectrum disorder signs you experience as a kid may be completely different from what you experience as a teenager. Let's get into what the common signs of autism spectrum disorder look like in older children and teenagers. Social communication signs of autism in older children and teenagers. Older autistic children and teenagers have differences in the way they use verbal and non-verbal communication for social purposes compared to other children and teenagers. Verbal communication. Older autistic children and teenagers might find it hard to take turns in conversations. For example, they might like to do all the talking or find it hard to answer questions about themselves. Talk a lot about their special interest, but find it difficult to talk a range of topics or things they don't find very interesting. Take things literally. For example, they might be confused by the expression, pull your socks up, and actually pull up their socks. Have differences in their voices or ways of speaking compared to other children. For example, they might speak very loudly or with an accent, or their voices might not vary in tone or volume. Have very good vocabularies and use formal language. Find it hard to follow instructions with more than 1-2 steps. Non-verbal communication. Older autistic children and teenagers might have difficulty reading non-verbal cues like body language or tone of voice to guess how someone else is feeling. For example, they might not be able to tell when someone is teasing them or using sarcasm. Make less eye contact than other people or not use much eye contact when they are spoken to. Show fewer emotions on their faces than other children, or not be able to read other people's facial expressions. For example, they might not be able to tell when someone is bored. Use few gestures to express themselves. Developing relationships. Older autistic children and teenagers might prefer to spend time on their own rather than with their peers. Want other children to play by their rules and get upset if their rules are not followed. have trouble understanding the social rules of friendship, have difficulty making friends and have few or no friends, have trouble relating to most children their own age and prefer to play with younger children or adults, have difficulty adjusting their behavior in different social situations, be more comfortable with close personal space than other people. Behavior signs of autism in older children and teenagers. Repetitive behavior and interest. Older autistic children and teenagers might have particular or special interest. For example, they might collect sticks or memorize football statistics, but not really be interested in the game. Have behavior that seems compulsive. For example, they might line things up or need to close all the doors in the house. Be particularly attached to certain objects. For example, they might carry toys around or collect certain items like chip packets or shoelaces. Be upset by change and like routines. For example, they might need to be told in advance when their usual routine will change, or they might have a routine for getting ready in the morning. Repeat body movements or move their bodies in unexpected ways. For example, they might flap their hands or rock back and forth. Enjoy making repetitive noises, for example, grunts, throat clearing, or squeals. Sensory sensitivities. Older autistic children and teenagers might be sensitive to the sensory environment. For example, they might be more easily upset by loud noises than other people, or not like tags on clothes, or eat only foods with a certain texture or color. Seek sensory stimulation. For example, they might like deep pressure, seek vibrating objects like washing machines, or flutter fingers to the sides of their eyes to watch the light flickering. Respond less to pain than other children. Common issues for autistic children and teenagers. Older autistic children and teenagers often have other issues as well, like sleep difficulties. For example, they might have difficulty falling asleep, or they might regularly wake up or have broken sleep patterns. Anxiety, feelings of being overwhelmed or meltdown. For example, they might be anxious about going to new places or being in social situations with a lot of people. Depression. Older autistic children and teenagers who are aware of that they are different from other people are also often aware of how others see them. They can feel like outsiders. Other people might bully them for their differences. This can lead to feelings of low mood, which changing hormone levels in puberty can intensify. Aggressive behavior. Autistic children and teenagers often have sensory sensitivities that can lead to sudden and sometimes aggressive behavior. They might have difficulty understanding what is going on around them. This can lead to a build-up of frustration which children cannot control in the moment. Eating disorders. These can develop in autistic children and teenagers as a way of controlling their environment. For example, they might have difficulty moving to secondary school and might develop an eating disorder to cope with feelings of anxiety. executive functioning difficulties. These are the mental processes involved in planning, organizing thoughts and activities, prioritizing tasks, and managing time efficiently. Because of these difficulties, autistic children and teenagers might find aspects of secondary school hard to manage. For example, complex timetables. School refusal. Autistic children and teenagers might feel overwhelmed or confused at school. They might also be vulnerable to bullying at school. These signs might be the starting point for a late autism diagnosis. Having a diagnosis can help you to support your child's development and well-being during adolescence and adulthood. Also, if your child knows they are autistic, they can understand themselves better. Be proud of who they are and find friends who think, interact, and learn in similar ways to them. Thank you.